This is Dr. Christopher Magnus from magnumopusastrology.com. What is Decumbiture? Introducing Traditional Medical Astrology. Hippocrates, the ancient sage widely regarded as the father of diagnostic medicine and the source of the Hippocratic Oath, once remarked, "A doctor who doesn't know astrology should call himself a fool rather than a physician." The kind of astrology that Hippocrates used was vastly more sophisticated than the natal sun sign astrology that most people are familiar with today. In fact, the classical astrology of health and medicine isn't based on the birth chart at all. Instead, it uses the chart for the exact time that the patient falls ill or takes to the sick bed. This branch of astrology is called decumbiture, from the Latin word decumbo, which means to lie down. Getting the gist of how a decumbiture chart works can give us some often very helpful insight into our health concerns and how to begin dealing with them. Traditionally, the ideal time to set up a decumbiture is the first moment the patient feels so unwell that they have to lie down. But in real life, lots of people grit their teeth and push through that moment without taking to bed, even if they want to. And with chronic illness, it can be hard to remember the year, let alone the day and time when one first felt unwell. In those cases, other times can be used to great effect. The recorded moment of an accident or other traumatic event, the first phone call to a specialist, the first office visit, the time of a surgery, even the time when blood and urine specimens are collected. When reading a decumbiture, we're mostly going to be interested in 5 of the 12 houses of the chart. The first house, or ascendant, which describes general health and vitality. The 6th house, which describes the illness. The 7th house, which describes the physician. The 8th house, which shows the likelihood of death. The 10th house, which shows the treatment. A decumbiture can be looked at as a kind of horary, in which the implicit question is, will the patient recover, and how? As with horary, the symbolic link between these houses and the individual is made through the zodiac signs that are found on the house cusps, together with the corresponding planetary rulers. For example, if the ascendant, the first house cusp, falls in Virgo, then the planet Mercury, which rules Virgo, is the patient significator. In a sense, Mercury is the patient, so looking at Mercury's condition will tell us about the patient's body, health, and vitality. The same reasoning is repeated for the 6th, 7th, 8th, and 10th houses to find significators for the patient's illness, physician, astrologer, death, and medicine, respectively. In addition to the houses and their significators, the moon plays a major role in every decumbiture. Just as the moon passes through cycles, and in so doing makes the tides ebb and flow, so the decumbiture moon is understood to show both the cycle of the illness and the flow of life force through the body. For this reason, in decumbiture, the moon is seen as a co-significator of the patient's condition and prognosis. Prescribing treatment based on the decumbiture chart should, of course, be reserved to licensed physicians who understand both astrology and medicine. Some herbalists, homeopaths, and naturopaths are also qualified to use decumbiture in their practice. Nevertheless, in the hands of a skilled traditional astrologer, decumbiture can provide information that might otherwise be unavailable to a client who is taken ill. It frequently brings peace of mind, particularly when we can see disease and cure unfolding in time with the chart. Best of all, it can equip clients with otherwise unavailable information, helping them make better decisions about their medical care.